Hi, Teen Health Source. Do you have a question?
Not everyone's comfortable talking about teens having sex.
What would you like to know about contraceptives?
Either way, a growing number of young people want to better understand intra-uterine devices, or IUDs.
They do come to us asking, I read this, is it true? Or just a lot of questions on IUDs.
They may be relieved to find out the Canadian Paediatric Society now says it supports the use of IUDs for teen girls as a first line of defense against pregnancy.
We're not saying you must force young people to use an IUD or an IUS. We're saying that intrauterine contraception is the most effective method of contraception, and so you should be talking about it.
And there's a lot to talk about, including the two main types. This copper coil device is an IUD. Another version that releases hormones is called an intrauterine system, or IUS. It's placed inside the uterus by a healthcare provider to prevent pregnancy for up to 10 years. The device carries a small risk of tissue perforation when inserted and cramping afterward. IUDs are the most widely used reversible contraceptive method in the world, except in North America.
In the 70s, the Dalcon Shield gave IUDs a really bad name.
Nurse practitioner Kristen Heisey knows the history,
the IUD,
including claims that early versions of the device led to infections, ectopic pregnancies, or worse. But experts say the interpretation of those studies was flawed. Complications can happen, but experts say they're uncommon.
Things have changed. The IUDs of the past are not the same IUDs that we currently use. I insert quite a few IUDs daily. It's anywhere from like a 0 to 4 a day.
And another common question we get is, can I get an IUD without my parents knowing?
The answer, yes, as long as you can show that you understand the risks. But the Canadian Paediatric Society says this is about options. Any birth control is better than none. But add, only condoms protect against sexually transmitted infections. Christine Burak, CBC News, Toronto.
For more on this, I'm joined by Dr. Danielle Martin with Women's College Hospital here in Toronto. You know what, one thing watching that story I'm curious about is, what's your sense of why this is happening now?
You know, in many ways, this is just Canada catching up to the rest of the world. The IUDs and intrauterine systems have been very popular all over the world, and particularly in Europe, for a long time. And the Paediatric Society is now catching up with other groups like the Society of Obstetricians and Gynecologists, who have long recommended these long-acting reversible contraceptive methods for women of all ages.
So now it's just focusing on the teens.
Now we're focusing on the teens, and I think it's a really important population to focus on because, of course, the consequences of unintended pregnancy in teens can be devastating, not just, you know, for the young woman, but for her whole family. And so it's an important conversation for us to have.
So it's one thing for doctors to just switch a recommendation. It's something else to actually go through with it. Are doctors actually ready for this?
I mean, I think we're in varying states of readiness, to be honest. And one of the big differences between these IUDs or IUSs and the pill, which is by far the most popular form of contraceptive among young women in Canada, is that for the pill, you just have to write a prescription. But for these intrauterine versions of contraception, the doctor actually, or the healthcare provider, has to insert it. And so there is some training that is required. It's not a difficult thing to do at all, but it does require some training. And so it is, I think, going to take us some time as a medical community to catch up to this being the norm. And if we want to make sure that young women have access to these forms of contraception, I think we have to be wary of getting into patterns where young women just get referred off to see specialists, or, you know, if they're living in communities where they don't have access to clinics or their own family physician hasn't been trained to insert these devices, what does that really mean? So we do have to make sure that if we're serious about this recommendation, that we offer the access appropriately.
One last thing, very quickly, anything that worries you about this?
I worry about sexually transmitted infection. You know, teens need to understand that these hormonal forms of contraception, whether it's the IUD, IUS, whether it's the pill, do not protect against HIV, chlamydia, gonorrhea. And so these are important risks, and in order to protect against that stuff, you need to use a condom.
Okay, fair enough. Dr. Danielle Martin, thanks very much.
Thanks.